Hello. Good morning, everyone. Now we will start with our free consultant paper session. For this session, we have Dr. Deepak Savalake and Dr. Vishal Dange as a Vishwas Dange as a chairperson. So I welcome you, sir. And now we will start with our first consultant, Dr. Shradha Karkamkar.
Pandre, and my today's topic is the study of correlation between clinical history and results of skin prick test in allergic rhinitis. The word allergy was first used by Clemens in 1906. Allergies are a number of conditions caused by hypersensitivity of immune system to something in environment. The diseases include hay fever, food allergies, atopic dermatitis, allergic asthma, and anaphylaxis. Diagnosis is typically based on a person's medical history, and skin prick testing is an essential test procedure to confirm sensitization in IgE-mediated allergic diseases. Skin prick test is the one that is most commonly used, and in skin prick test, the responses of skin to the IgE-associated allergens is assessed. In vivo tests are more reactive and less expensive compared to in vitro tests. Therefore, SPT is the most preferred one to identify the allergen. In patients with allergic rhinitis, identifying the allergens causing the symptoms as well as the environmental presence of allergens from the most important step in the treatment of the disease. Objectives of the study: allergen if known by the patient to find out whether it is the only allergen causing all the symptoms in that patient, and efficacy of skin prick test to detect allergen causing related symptoms in the patient, to find out advantages and disadvantages of SPT and correlation between history of allergy and results of SPT. Methods: hospital-based cross-sectional comparative study. A simple random sampling method was used for inclusion of study samples. Face-to-face interview in local language, and patients were informed about the study and its purpose. Data collection using pre-designed, pre-tested, semi-structured questionnaire. Thorough clinical examination of each subject, and patients were appropriately screened for allergies, discontinued medications that interfere with test results. And before allergy testing, details of past allergic reactions experienced, family history of specific allergies and past illnesses, lifestyle, work habits, food and eating habits were taken. Inclusion criteria: alleged history of allergy, 18 to 50 years of age, both sexes, chronic history of allergy and not relieved or just temporarily relieved by symptomatic treatment. And exclusion criteria was patient with skin lesions such as leprosy, eczema or dermatographism, a patient with any major medical disease such as diabetes mellitus, hypertension or ischemic heart disease, or antihistaminics and steroids, and patient with hypersensitivity reaction. Immunocompromised patients were excluded. Tests were applied to volar aspect of forearm, at least 2 to 3 cm from wrist. Distance between two SPTs should be more than 2 cm. Lancets or needles were the tools of choice. Histamine and normal saline was used as positive and negative controls respectively. 56 allergens was tested on patient's body as the allergies watches the signs of an allergic skin reaction. Negative, 1+, 3+, and 4+ results were assessed and analyzed. This is the picture showing performing SPT on volar aspect of forearm of patient. According to IBQ et al., in their study, the prevalence of allergies was 3.16%, considering 95% confidence level and 10% allowable error. The sample size was 100 by following formula. N is equal to Z2 into P into Q E square. 5% population added to above as non-response or incomplete answers. The collected data was numerically correlated and entered in Microsoft Excel 2007 and analyzed by using SPS version 20.0 statistical software by maintaining anonymity and privacy of respondents. Results: out of 100 study subjects, most of the study subjects were from age group 31 to 40 years, followed by 41 to 50 years. Very few, 3%, were less than 19 years of age. Out of total, majority were male, 57% patients were male, and 43% were female. Most of the females were from age group 31 to 40 years. and there were no patients from class 5, that is lower class. This means either these people are unaware of their symptoms or they don't have enough facility to visit and take treatment for their sufferings. Size and type of family mattered in a way that overcrowding and not maintaining hygiene might aggravate allergic symptoms in few patients. 70% subjects were belonging to a joint family, followed by 19% subjects having nuclear family, and rest had 3-generation family. Among 57 males, 49 patients had allergy and 8 patients did not have allergy. Sensitivity of my study is 89.01% and specificity is 100%. In 81 allergic patients, SPT was positive. In 10 patients, the test results were negative, but they were allergic to something, might be to some allergen outside the allergy kit. And in 9 patients, SPT was negative and they were not allergic to anything. Out of 100 patients, 38 had running nose, which was the most common symptom found, followed by sneezing in 22 patients. 16% had breathlessness and 13% had cold. Itching was the least common symptom found. Patients had multiple overlapping symptoms. And according to area guideline, house dust was the most common allergen found, followed by Congress grass and egg. These are few types of allergens, and I had presented percentage in males and females and total percentage. Distribution of study subjects according to allergy detected by SPT. Discussion. Etiology of allergic rhinitis is complex. It has 4 phases: sensitization, subsequent reaction to allergen, late phase reaction, and systemic activation. According to area guidelines, allergic rhinitis is defined if 2 or more symptoms of rhinorrhea, nasal itching, nasal blockage, or sneezing are present in patient for at least 1 hour per day for 4 days or more a week, and also for 4 or more weeks a year. Kianfer et al. Studied 41 students having food allergies, and results suggested that SPT was more sensitive than fecal or serum RAST. Co et al. Studied correlation between skin prick testing, individual IgE specific tests. If skin testing is conducted correctly, it is useful to confirm the diagnosis of specific allergy. According to Kellis et al., most common symptoms were sneezing and nasal obstruction respectively. Orenek et al. Reported sneezing as the most common symptom. We also found that more proportion of sneezer runners than blockers. This was supporting the finding of Lee et al. And Tatar et al. Rasul et al. Reported that SPT was positive in 86.4% of patients with allergic asthma. Conclusion. Clinical profile of allergic rhinitis patients and presence of allergies in them. Most common aeroallergens were house dust and pollens. Most common food allergens was eggs and prawns. Most common symptoms was sneezing. And SPT is very sensitive test to diagnose allergen. SPT requires knowledge and skill for the interpretation of result and application to the clinical problem of patient. These are my references. Thank you.
I request Dr. Deepak Sawalake sir to hand over the certificate to Dr. Shradha.